Bismillahirrahmanirrahim. Good morning, everyone. It's a great pleasure to be here, sharing my own experience of ozone therapy for low back pain or herniated disc back in Afghanistan. And it's a big honor to be standing in front of my mentors like Umair sir, Shehzad sir, and Farooq sir, who trained me. Not only trained me, but they also keeping encouraging me doing this in Afghanistan. So thank you very much, sir. God bless you all. I am Dr. HameedUllah Aman. I am working as a neurointerventionist in Kabul since 2017. Then I had been in Turkey and came back to Kabul. It's a quick review because the previous speakers, Shehzad sir and Dr. Omar, has brilliantly explained the whole mechanism in where we apply ozone. Ozone oxygen is basically as a mixture of the O2 entry that has been used in medical field since decades now for multi-purposes, and basically it revolutionized the field of pain management, and based on the theory that it has a remarkable antiseptic, antiviral, antibacterial and analgesic properties. And studies showed that when administered in a controlled amount and right technique, you will see the result very quickly, and patient will admiring you, because just by injection patient got relief of the back pain. So I'm here today to share my own experience in Afghanistan in 10-15 minutes in upcoming slides, that how we started this journey and how is it going. And we also conduct a small study which I am going to share the data here with you people. Anyhow, how it works, I think Dr. Omar has brilliantly explained that the mechanism of ozone. Just a quick review: inhibition of the pro-inflammatory prostaglandin, inhibition of the release of bradykinin and other allergenic substance, stimulation of antioxidant enzyme, inhibition of the release of proteinase by macrophage and neutrophils, and also increase the release of antagonists of the pro-inflammatory cytokines. This slide is very important just for young doctors who wants to start like me, and that they should keep this criteria in mind while selecting the patient. Because when you first start, you cannot take chances or risks by selecting the complicated cases. So as a doctor, this contraindication portion is very important for me. And what I am trying to do, that when not to do ozone in a patient. This is very important as a doctor for me. So I try to. I am very critical about the selecting of the people. And as far as the side effect and complication of ozone is concerned, till date, at least to my knowledge, no major complications or side effect has been documented yet. And here I am going to share our very first case that we did in Afghanistan. The first case we did in 12 December 2017. This date is very close to my heart, not only because of this patient, but because it's the birthday of my beautiful daughter. So it has always remained in my mind. It was a very mixed feeling day, because I had to rush back home after the procedure. Meanwhile, I was also very nervous because it was my first patient. So overall, it was a mixed feeling day, and I will remember it as a great day in my life in Afghanistan. We had a 33 years male patient, and for a picture I want to tell you that I have taken his consent. After that I put this picture here, so I didn't need to hide his identity. And the good point is that he's also smiling with us. That 33 years male patient complaining of back pain radiating the left lower limb since 2 years. On examination, SLR was between 50 degrees. And we suspected L5S1 disc herniation, which was confirmed by the MRI. We applied 2 sessions in a span of 3 months for this patient, and even he showed tremendous improvement of the first session. I didn't want to go for the second session, but it was his decision. He said that I'm going abroad, so I need to be sure nothing will happen. And this is the pre-procedure image of disc. You can see it on the left side this here, and the shape of the disc, as you can see. And this is the post-procedure. You can see here, and the disc is, the disc size is decreased its size and getting it to its normal shape. And now it's been almost 6 years. He's living there, doing his business, and I'm still waiting for the gift he promised me, but I haven't received it yet. Hopefully, in next 6 years, I will receive it, inshallah. He's a good friend now. And this is the method we do. As everyone knows that how we do ozone. I also do ozone in cath lab under fluoro. After the examination, the patient will take patient to the cath lab and at the dose of 4 to 6 ml at the concentration of 27 and 30 microgram intradiscal infiltration. We do an oblique view or transpedicular approach. As I learned from Umar sir, I also do the same position, and it's very successful till now. And after the procedure, we kept patient for 3 or 4 hours in hospital. Then we discharge him with medication and precaution. Then we follow up the patient for 1 month, and after 1 month, I advise them physiotherapy short or 10 days physiotherapy course. And after the end of the 6th week, I call the patient back and ask him to see how the improvement. If also he or she can afford, we do a comparative MRI. But overall, you can estimate that from his clinical history that how did he or she improved or not. But if he say that okay, I'm okay, I'm better than before, I should 50 or 60% better, usually I don't go for second session. Then I advise him to keep these precautions, and also advise him that physiotherapy course again, it will increase, and it works basically in Afghanistan for my patients. And this is the method, as you can see, intradiscal infiltration over the pedicle. After starting the ozone, we want to make sure that what you are doing is it safe or not for the patient, and also to share with our other colleagues, doctors. We conduct a small study of 23 patients. This study basically was designed for 2 years time, but for this very conference, this is a 9 or 10 month data. So the data in this data here is not the final or the last one. It can change or differ after completion of assigned time. We enrolled 23 patients, out of which 13 was female, 10 male patient. Patient age was between 33 to 72 years. 21 patients suffering from low back pain, 2 patients suffering from cervical discogenic pain, and we had 1 post-surgical or failed back syndrome in this, which is included in the low back pain patients. And out of these patients, 2 undergone the surgery, which I will talk about it later. Okay, how we select the patient. Again, I want to emphasize on that selecting patient plays the vital role in the result of the treatment. So for young doctors, I will advise that don't go for complicated cases, make it simple. And we also, because of this, we just keep it simple and basic. We just focus more on low back pain with radiculopathy, cervical region pain, affected region numbness, which due to this, and failed back syndrome. And any patient who comes with this cardiac corner syndrome, lower limb nutritional deficit infection, malignancy, fracture, grade 3 stasis, calcified, discalcified, we just keep them out of this study. And as a data chart, if I am sharing with you that I said it was 23 patients total, 10 out of which were male patients, which make 43% of the total total study. 13 female patients, which make 57% of the total amount of the study. Among these patients, 21 patients receive lumbar spine, were suffering from lumbar spine or back pain, 2 from cervical pain, and the one with failed back syndrome also included in this this category. 21 patients receive only 1 session yet, and they have showed a very good result. But I'm saying again, I'm repeating again that this may differ. Maybe some patients need after some time, but till now, 21 patients has showed very great result, which make 91% of the total amount of result. And 2 patients of this who one is working in I think army or police, the other is was working in a cargo company. I did 2 or 3 sessions for them. After that, when I realized that ozone is not working, so I referred them to my neurosurgeon colleague. And after that, they both undergone surgery. I asked when I discussed the patient, when I went there to discuss the cause, the neurosurgeon told me that one of them, we also saw in the MRI a recurrence disc because he had left heavy weight, and the disc was recurrent disc. And the second one was due to unstable or unstable spine or facet joint instability. So the neurosurgeon told me this was the cause, so they should both gone for surgery, and they are doing well now too. As far as side effects are concerned, no serious complications or side effect we have been witnessed yet. Frequently patient feel pain or headache, especially when we do a cervical spasm or a tingling at the site of injection or lower limbs, which would subside after 2 or 3 days. So why we do ozone? This is also I have to tell. Now, previously, if someone asked how you convinced your patient, I want to tell him that this. And that I always tell my patient, because the main thing, that advantage of ozone is that no anesthesia, no scarring, no general anesthesia. At this point, no general anesthesia. Whenever I tell my patient this, I see a spark in their eyes, and they say, "Okay, doctor, proceed. What next?" So at the moment, I feel that 50% of my work is done. So the other 50% is how to do the procedure. And no post-procedure complication, relatively cheaper as compared to the surgery, and short hospital stay that we have been also witnessed. This idea of advantage of ozone also strengthened by other studies which have been done throughout this time. You can see the references here. I couldn't pronounce this one. And this study, the author said that the intradiscal O2E3 infiltration decreased the requirement for conventional surgery, resulting in a significant decrease in hospitalization and associated costs, which is very true. We also witnessed the same thing back in home. And I like these 2 studies, comparative studies between ozone and microdiscectomy in ozone versus TRICE. And basically, the one with microdiscectomy was done by Boris J. In his study, he treated 30 patients with ozone and 15 with microdiscectomy, and he says that he found no difference in the clinical outcome. However, I will say that for microdiscectomy patient need to go for under general anesthesia. So for ozone, you don't need anesthesia. So for that very reason, I think ozone is a bit superior, maybe superior than the microdiscectomy due to the general anesthesia issue. And other study, ozone versus TRICE, this is very important one also. Whenever the patient come to me, they ask me, "Okay, doctor, I have received injection into my back. What's the difference between this and ozone?" So whenever I encounter such a question, I tell them that steroid is symptomatic and temporary, and you cannot avoid surgery with that, because the mechanism which if this herniated disc is still remain if you don't do the pathologic process. Author Matthew and other authors say that effect of administration of O2E3 treatment has proved highly effective in relieving acute and chronic low back pain and sciatica. Therefore, we suggest administration of the gas mixture as a first choice treatment to replace the epidural steroid infiltration to avoid surgery. Just recently, on Saturday,